has suffered with back pain, neck pain, leg pain and everything else. But in labor, what do we do? Anybody has any idea? Let us talk about it. So the reason why physiotherapy is very important during labor is, tomorrow morning, Sunday, usually we'll have marathons early in the morning. If I ask you to enroll tomorrow for 5 kilometers marathon, can we be able to run? No. Why? We are not prepared for it. Simple. We won't have enough cardio to run. Our muscles are not quite strong enough to support us through 5 kilometers. So, but labor is more than a marathon. This is almost 18 hours, 12 hours marathon it is. So imagine the amount of strength our body requires to go through the labor. Okay? But again, this is there in our hands to shorten it. If we are prepared for our labor from months before, then we can finish it and get a first prize. Okay? So this is a small overview about why it is very important. So let's talk about what is labor first. So anybody has what is delivery? Delivery agtate. You have ever heard of people telling, adun tagoli bega delivery agate, idin tinni bega. You eat this fruit, it'll help you progress faster. You have pain, have jeera water. Let us see what is it. Right? How many of you have heard of all of these advices? Nobody. You have good relatives then. Nobody has heard of anything. Usually they tell, pregnant, take rest. You should not even lift a stick. How many of you have got this through? They'll be like, go to mom's house, take rest, don't do anything. They'll give you good food, eat, sleep, repeat. Correct? Nobody is doing that. I have a very good crowd then. All pro for exercises then. Okay? Yes. So labor is nothing but the process of baby coming down through your pelvis. Okay. So everybody has seen what's pelvis, alva? Pelvis is a bony structure that it holds like this. It's a big, we can imagine a pot. It'll have a narrow opening and a huge neck. Okay. So that will be something like that. Imagine a pot or a balloon. Okay, so stages of labor. The first stage is nothing but a woman feels contractions. What is a contraction? It's a fancy new word, contraction. What is it? Compress. Okay, something similar. So cramps, yes. How does the labor start? How does it start? No one has watched movies? I remember this one particular patient. She used to always, I don't forget her, it's almost been 3 years back I met her. She's like, Ma'am, how they show in movies, it's like that, I scream loud and the baby comes out. She asked me this question. From that time, I make sure I repeat this and ask patients what do they know about labor before we telling everything. So what is labor? Contractions, cramps, yes. How does a cramp start? Yes. Okay, so the labor is again divided into parts. These are the 4 stages of labor you can see. But again, once you get contractions, again it depends on what type of labor you are in, whether it is latent labor or active labor. So what is latent labor? As she said, slow contractions. So basically what is contractions? Contractions are nothing but tightening of your abdomen region. If you palpate your belly now, it is soft. Wherever the baby is there, only there you can feel little hard. Otherwise, it's pura khali khali. But when the contraction starts, the whole abdomen becomes hard. Okay, that is contractions. Sometimes it might be a false contraction. That's why they tell have jeera water and dekhte hai kuch kya hota hai. Then they'll come to the hospital after 3 hours. They'll be like, it was there, but it is not there now. Okay, so that is nothing but false contractions. Slowly it will start. Okay, let's see like this. Contractions, we'll see 3 things. Frequency, duration, and how the pain increases. Frequency is nothing but in 10 minutes. We will assess every 10 minutes. In 10 minutes, how many contractions you are getting. For example, as she said, you are getting 1 contractions for lasting up to 20 seconds. So you are getting 5 minutes once. So how many contractions are you getting in 10 minutes? 2. So 2 contractions in 10 minutes. That means what? You are into the labor, but still you have a long way to go. It's just the start line of the marathon. Abhi picture baki hai. Okay. So that is 1. As the pain increases, so where we have to have 2 contractions lasting up to 20 seconds in 10 minutes, now it increases to 3 to 4 contractions coming up to 30 to 35 seconds in 10 minutes. So you understood the frequency, the duration, it is increased than before. That means that you are in active stage of labor and baby also has come down. It has descended into the pelvis. Okay, so the first stage is nothing but you are having contractions. Okay, so you have reached first stage, then latent labor, that means you are dilated till 3 centimeters. Your baby is little come down, but just half the way to come down. You are increasing in pain, we shift you to the labor room. Okay, so that means that when we shift you into the labor room, that means that you are in the active stage of the labor. So where you are almost dilating faster, then the baby head has come down. All you have to do is push the baby out. Okay, that is the second stage of labor. Third stage of labor is the placenta has to come out. Placenta is nothing but is an organ that provides food to your baby. Okay, that is third stage of labor. Fourth stage of labor is when you feed the baby, that is the lactation period. What is effacement? So, what is dilatation? You can see 1 centimeter till 10 centimeters. This is called as dilatation. So, when the contractions are very minimal, you will be around 1 to 2 centimeters. You can see that tiny opening and you can see the 10 centimeters opening. How many of you got scared? The reason was not to niman bhaya parsonantalla. We wanted you to be aware how the baby comes out. So you understood how the baby slowly was coming down, right? So the why exercises help is we are turning a gully road into a highway, so we can come through fast. Okay. So again, each woman is different. Okay, her pain tolerance is different, her bone structures are different, her flexibility, strength, everything is different. So we can't teach all the exercises to everybody. For example, one woman might be comfortable doing squats when she has contractions, the other woman might be not. So we can't see every woman has same. So our exercises also changes according to each woman. So it is not the same. Okay, fine. So these are the exercises that I will show you. So the first exercise is about pelvic rocking. You can sit on the birthing ball. Okay, you don't have to be scared that I don't know, I'm not used to it. What if I fall? So don't worry, we'll be there in the labor room to tell you how to use it, and your husbands will be there to support us back. Okay, so you sit like this, you keep your legs front, you not keep your legs wide. If you keep our legs wide, we will not get the base of support. So we'll keep our legs front, okay, and we will tilt backwards and forward. Okay, you can see. So what type of breathing should you do when you have a contraction? Okay, so along with the movement, what I do is I take a deep breath through my mouth. Okay, better way to understand this. How many of you like masala puri here? Everybody has eaten masala puri? Yes. It is very hot. How do we blow our food? Same. But we will not give you masala puri in labor room. Okay, so you can imagine in your head, breathe in, breathe out. Breathe in, breathe out. Okay, this is one of the position. Second you can do is circles, clockwise and anti-clockwise. We have to move our hip along with our body. Okay, we can't just do like this. Complete movement. The baby inside the pelvis also has to feel the movement. Okay, this is one, second position. Third is you can bounce on the ball. Okay, fine. This will help you to relax as well as dilate faster. Okay, this is one, using birthing ball. Second is we can do squats. Okay, how do we do squats? Keep your legs wide, keep your feet out, keep your back straight, and we squat down and up. Again, your exercises differs according to how many weeks of pregnancy are you in. Okay, above 30 weeks only we usually recommend to do all of these exercises. Above 30 weeks, you have to do only half squat. You can't do full squats. Above 35 weeks, you have to completely sit down and get up. Okay, so how many of you are in below 35 weeks? Above 30, below 35? Okay, above 35? Yes. Let's have a small demonstration along with your partners here. So will you all please get up? Okay, fine? Yes. Less than 30, you can do only the movement. Don't try to bend down. Above 30, half squat. Above 35, full squats. Okay, understood? Okay, so hold your partners. 30, just the movement. Above 30, below 35, half squat. Above 35, full squats. Okay, if your slippers are not sturdy enough, please remove it. Hold, legs wide, ready? On my count. 1, hold.
Hold elbow to elbow.
Yes.
Elbow to elbow.
Down.
Support.
Good. Again, down. So you have to hold elbow to elbow. There you will not get a grip. Above. Yes. Again. Down. Up. Yes. So how many of you felt very difficult? How many of you felt, hey, it's very easy, I can do it? Easy. She attends my class, so she knows that it's easy. Others? Easy? Fine. You have to start practicing it every day. Okay. According to the WHO recent protocol says 150 minutes of exercises a woman can do per week. So divide and be active as much as possible. This is for one of the exercises. Second exercises you can do is keep your legs wide. Okay. We sway our hips. Only hips. Bollywood style. Sway. Sway. Yes, ma'am. Sway. This is the movement. But how does the husband involve in this? So they turn, okay, the mothers lean on them, put their weight, the husband will hold, and both of them will sway. Okay, now it's fine, but when you have pain, it helps you. Trust me, it will help you. Why we are stressing on husband is nothing but we telling you everything is okay and husband telling you everything is okay has a lot of difference. So that's the reason husband plays a very vital role. Okay, so can we try this? Left, right, left, right, left, right. Move, 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 move. Left, right, left, right. Okay, fine? Okay, coming to the next part. Sit on the ground, put your weight on the ball. If husband is not available at that time or you are irritated because he caused you pain, then we'll ditch husbands in the labor room. Okay, we'll take the ball, lie on them, go forward, backward or sideways, sideways. Okay, fine? This is one. Next is importance of role of husband in labor room. The role of husband is, what is the most important thing the husband should develop when your wife is in labor room? Correct. Patience, tolerance and extra pair of shirt. Why? They'll hold your collar. Pain bartide ninnindane agiddu, they'll pull your collar. Then you should have an extra shirt. Okay? This happened to one patient. His collar was here. By the time she delivered, his collar was here. Papa, he didn't have a shirt. Okay? So it is very, what all you can do is, you can massage her back when she is in pain. You can give her a support during the exercise part. You can encourage her during the pushing. How do we push the baby out now? Baby has come down, you have done all the exercises, baby has come down, you have to push the baby out. How? So there are other different methods of pushing the baby out. Okay, it's not necessary that you have to lie down on the bed. You can squat and push. Okay, whenever there's a pain, your baby is down, we will like squat, we will give pressure. Pressure, push, 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 down. Again up. Again push, 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 down. This is one. Second is, you can hold here, sit on, again push, 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 down. Okay, this is one of the method. Okay, so why I'm talking about exercise from that time. Nobody asked, will it help me to reduce pain? Okay, exercise will help you to reduce pain, not completely, but it will make you feel comfortable along with the movement. What type of breathing should I do when I push? It is like, how do we, between the contractions, what you have to do is, how do we smell a rose? How do we blow a candle? That is between the contractions. We are pacing our heart so that the next contraction we gain energy to push. Okay, so what you have to do is, whenever you contractions, we have to hold your breath for few seconds, and this is like how we do, for example, if you have constipation, how do we push the potty out? Like that. Okay, fancy word is push in labor room. We can't tell do potty, we have to tell push. Okay, so that is how you push. Hold your breath. Everybody hold your breath. 5 counts. Everybody, including the husband. You should know how difficult is it to push. Okay, hold your breath. 5 counts. Try to push down. 1, 2, 3, 4, 5. Breathe out. So this you have to repeat till the baby comes out. So you understood why should the next between the each contraction, why should we smell the rose, blow the candle to pace our heartbeat and regain the energy.
Now it's time to add some glamour and fun to the day. Pregnancy glow is real, and today we are going to celebrate it on our very own parents to be ramp walk. Each couple will walk together on the ramp and show us their confidence, style and love. Remember, this is not about perfection. It's about celebrating this beautiful phase of life together. So couples, get ready, smile big, hold hands and own the ramp. Okay, so all of you walk from the left side of the stage, enter, walk, give a pose together and exit from the right side. Okay, all the best.
Myself Suraj and my wife is Sindhu. We are she is into 35th week. Till now everything is going fine by God's grace. She's enjoying a pregnancy period. That is about us. Thank you.
Hello all, I'm Rahul and she's Ankita. We are into our 36th month of pregnancy, 36th week of pregnancy, sorry. And yeah, she's not enjoying her pregnancy that great, but yeah, it's all nature. Yeah, having a good time. Thank you all.
name is Pradyumna. My wife is Hemalata. Now, she is 34 weeks. It requires a lot of patience, tolerance for both. That's the main thing, actually. Yeah, we're enjoying.
Hello all, I'm Darshan V and she's Sri Lakshmi. We are into 32 weeks of pregnancy and we are enjoying it, all the kicks of baby. We are enjoying it.
ನನ್ನ ಹೆಸರು ನಾಗೇಂದ್ರ, ಇವಳು ಪ್ರೀತಿ. ಸೀಸ್ 38 ವೀಕ್ಸ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ರನ್ನಿಂಗ್. ತುಂಬ ಎದುರ್ತಾಳೆ. ಇವಾಗ ಅವ್ರಿಗೆ ಎಕ್ಸಸೈಸಸ್ ಎಲ್ಲ ಮಾಡಿಸ್ತಾ ಇದ್ದೀವಿ. ನನ್ನ ಟೈಮ್ ತುಂಬ ಕ್ರೂಷಿಯಲ್, ನಂದು ಟೈಮೇ ಸಿಗಲ್ಲ. ಮನೇಲಿ ಯಾರು ಇರಲ್ಲ, ಹಸ್ಬೆಂಡ್ ವೈಫ್ ಅಷ್ಟೇ ಇರ್ತೀವಿ, ಊರಲ್ಲಿ ಇರ್ತಾರೆಲ್ಲ. ಸೊ ಅವಳಿಗೆ ಇವಾಗ ಒಂದು 1 ಮಂತ್ 1.5 ಮಂತಿಂದ ಎಕ್ಸಸೈಸಸ್ ವಾಕ್ಸ್ ಎಲ್ಲ ನಾನೇ ಆಫೀಸ್ ವರ್ಕ್ ಏನಿದೆ ಬಿಟ್ಬಿಟ್ಟು ಎಲ್ಲ ಇವ್ರ ಜೊತೆ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ವಿ ಆರ್ ಎಂಜಾಯಿಂಗ್.
Hi, I'm Nikhil. This is Sharvani. We are in the 6th month of pregnancy. This is our actually second kid. First kid is almost 4 years old. And we have named the baby Rio as the nickname for now. Our first kid's nickname was Simba. So we just named the second kid as Rio. We are hoping it's a girl because we have a son already. So we are hoping the second one is a girl.
This is Suhas and my wife Ashrita. So she's into 24th month, 24th week, sorry. So this is the first of our experience. So we are facing a lot of challenges going on with it. So enjoying it. So post that also we might enjoy, I don't know. So how it goes. Thank you. Thanks a lot.
I'm a sister and I'm very excited, Masi, to be. Yeah. And
my name is Bhavika. I am in my 36th week right now and I am feeling very, very grateful.
Hi, I'm Arvind. My wife is Geeta. So she's into 35th week today. So we are enjoying the process. Thank you.
हमारा फर्स्ट बेबी बॉय है, सेकंड हमारा लड़की होना चाहिए, ये हम भगवान से प्रार्थना करेंगे.
She's around 26th week now. She has a lot of willpower and our sleepless nights started, particularly mine. She has very bad night cravings. At least 4 to 5, at least 4 times, minimum 4 times I used to get up. We both used to get up, yeah.
ಒಂಥರ ಮಗು ತರ ನೋಡ್ಕೋಬೇಕಾಗಿದೆ ಇವಳನ್ನು. ಇವಳು ಒಂದು ಮಗು, ಇವಳಿಗೆ ಒಂದು ಮಗು ಆಗ್ತಿರೋದು ನನಗೆ ತುಂಬಾ ಖುಷಿ ಇದೆ, ಇವಳಿಗೂ ಖುಷಿ ಇದೆ.
beautiful couple there.
We are proud to announce that we have been registered with Aryamba. Yes, absolutely. Absolutely. We are the first of our kind. Yes, I think so. So, welcome to Aryamba. You will have a safe labor and we'll make it enjoyable, and they will make it enjoyable. We will also participate. The experienced people can participate and make it very enjoyable, isn't it? Yeah.
Okay. So we'll be waiting to, take care of you in labor. So one by one, 38-weeker, 35-weeker, all of you will keep meeting, and hopefully we'll also deliver by then.
Okay. Music on, please, because we want to enjoy.
I love my husband and even Tulsi ma'am.
And after making everybody walk on the ramp, how can we leave our physio team? So I guess they should also go on the stage once. Come on, guys.
We hope we see you doing a lot of exercise and take a lot of information from this. So be active. Remember the marathon and masala puri for life. Okay. Thank you.
In terms of confidence and coordination and happy, healthy appearance, we have Jesh. So, I mean, everybody is fairly close, but we had to choose one. Okay, thanks. So, Sri Lakshmi and her husband.
The winners. Okay, so now let's see how attentive our audience was during the physiotherapy session. Okay, so let's have a quick round of rapid fire. The rules are whoever lifts their hands first will have the mic with them, and then more number of points will win. Okay, so don't worry, the questions are very simple, and the goal is to have fun while remembering useful tips for pregnancy and labor. Okay, so raise your hands if you know the answer. First question is, what type of breathing is done during labor? Okay. Husbands?
So it is inhale and exhale, that is rose and candles. I don't know the specific terminology.
Okay,
but
yes, correct answer. Tell me any 3 different positions of pushing. Okay, the wives.
Squat, then lying on an inclined wall, and lying down.
Lying down.
Yeah, you can even lie in the, I think that cat and cow pose.
Yeah.
And then do front
On
and
force.
back. Yeah.
Yes. Physiotherapy can reduce pain during labor. True or false? Husbands? Come on, wives, give the good competition.
it can not only reduce pain, it can go to an average level and it makes the mothers comfortable.
Okay, next question. How many weeks is ideal to start prep for labor physiotherapy? Husband?
30 plus.
Yes. You can do early as well, but for the labor, it's 30 plus is ideal. Next question. What is the goal of breathing exercises in labor?
To reduce the pain?
Yes, to manage with the pain. Next question. Physiotherapy will not help in postpartum recovery. True or false? Just raising the hands, huh? Yes, wise. Correct. What is one myth about physiotherapy in labor? Yes, husbands?
It might be 2 ways. Maybe sometimes people tell it is commercialized, the old generations. Second thing, wherever it is physio, they might even tend to say that ki pain hoga hi nahi, is what I believe.
Next question. Physiotherapy exercises can reduce the need for epidural. True or false? Hands. No mass answering, please.
True.
Yeah. Women. Yes. Next question. Can partners be involved in the labor? Husbands, come on, wives, give the competition.
Yeah. Somebody who is very intimate to you, with whom you can express your feelings, they should be there. That is scientifically proven to reduce the pain and also the well-being of women during labor is very, very important. Otherwise, you can have incoordinate stress ತುಂಬಾ ಇದ್ರೆ contractions ಕೂಡ ರೆಗ್ಯುಲರ್ ಆಗಿ ಬರ್ತಾ ಇರಬಹುದು. And also fetal distress ಅಂತ ಅಂತೀವಿ. Every painಗೆ ನೀವು ಒದ್ದಾಡ್ತಾ ಇದ್ರೆ the baby also gets distressed. So all this, if it has to reduce and if the labor has to progress smoothly, a partner in the labor ward.
Labor companion, yes. Labor companion is very important. Even in rural areas, we want labor companions to be there. People who are trained in relieving, giving some relief to the laboring woman, and also teaching her different positions, etc., along with the mother. Government of India has made it a mandate for people to have labor companion. That is found to be enormously beneficial. So please train yourself to be really tolerant, because they will have a lot of pain. See, the pain of labor actually is graded or rated more than the amputation pain. ಕಾಲು ಕಟ್ ಮಾಡಿದ್ರೆ ಅಥವಾ ಇನ್ನೇನೋ ಕೈ ಕಟ್ ಮಾಡಿದ್ರೆ ಆಗೋವಂಥ ಪೇಯ್ನ್ಗಿಂತ ಇಟ್ ವಿಲ್ ಹ್ಯಾವ್ ಇನಾರ್ಮಸ್. ದ ನರ್ವ್ ಎಂಡಿಂಗ್ಸ್ ಆರ್ ವೆರಿ ಸೆನ್ಸಿಟಿವ್. ಸರ್ವಿಕ್ಸ್ನಲ್ಲಿ ದ ನರ್ವ್ಸ್ ಆರ್ ವೆರಿ ವೆರಿ ಸೆನ್ಸಿಟಿವ್ ಟು ಸ್ಟ್ರೆಚ್. ಸೊ please understand that it can be quite painful. That's why they will be behaving like that. But not everybody needs to behave like that. But there is a considerable amount of pain which we want them to cope as naturally as possible. We don't want them to be taken down to the bed. Thank you.
Thank you, ma'am. So the next question is, can physiotherapy help with breastfeeding issues? No. Yeah. Wrong question. Wrong answer, actually. Physiotherapy can shorten duration of labor. True or false? Husbands? True. Yes. Husbands. Next. Can the mothers perform exercises in the labor room? Wives? No, mass. What can you do now to make your labor smooth? Husbands?
Start physio.
What are the benefits of moving around during labor? No mass answering. Wives?
The muscles around the pelvis, they relax and help with the labor.
Yes, very good. Next question. How many times a week are you supposed to do the exercises? Husbands? Times. Yeah.
120 minutes. 120 to 150 minutes.
150. 150 minutes per week. Okay. Does screaming help during labor? Wives?
Screaming doesn't help.
Next question. Music helps reduce stress during labor. Wives? Correct. You should be confined to bed during labor. True or false? Wives? Okay. Husbands? Yes. You should not be confined, yeah. Can you perform exercises once your water breaks? Yes. What helps during labor pain? Breathing or breath hold? Wives? Very good. What type of exercises can you perform during pregnancy? Mild intensity exercises or moderate intensity exercises or high intensity exercises? Wives? It's actually, according to the WHO, it's moderate intensity exercises wherein you don't feel breathless. Okay? So it's nil, okay? Yes. What do you mean by moderate intensity exercises? Okay, I told the answer. Sorry, nil. Yes, you can exercises along with the laughing gas. Okay? You cannot exercise if you take epidural. True or false? Husbands? Yeah. How long can you perform exercises once you are in the labor room? Wives? Sorry?
Till delivery?
You can exercise for 20 minutes and then you let you rest for 15-20 minutes and then it completes a cycle like that. Okay? Okay, that's the end of the rapid fire.
Men have scored 12 points and women were just a little behind, 10 points. But as long as you all got the message, that's important. Okay.
Now next the event will be the couple dance. Okay? So we'll be doing the couple dance. We'll be teaching you in the form of exercises. Okay? Whoever does the best wins. Okay? Now let's celebrate that love with a couple dance. Okay?
Okay, first we'll be going to our right hip sways. Okay, hip sways.
Opposite.
Left, right, left.
You have to sway.
Okay,
Now
sway your
movement
hip.
should happen with your
hips.
Ready?
Next.
Yes.
Okay, next step you go right, left, your hip movements.
Okay.
Left. Okay. Next, you stand lunges. Okay, you stand and you just lunge.
Movement
Okay,
happens.
and again lunge. 4 times. Lunge, lunge. Okay. Next, the husbands. I'm doing the steps for the wife and she's my husband. Okay. And next, you do sumo squat and you just do right, left, right, left. Okay. Next, you come sides. You just do high knees. 1, 2, crisscross. 3, 4. Okay. And then the wives lean on the husband and do hip sways. Okay. Ma'am, it's very small.
We'll show you again.
We'll show you again with the music.
We'll practice with you again.
Okay?
Okay?
Okay? And that's it. Lunge. Left. Slow. Right. Left. Squats. You have to squat. High knees. Yes. Oh, ulta ಆಯ್ತು. Lunge. Squats. Yes, yes. Big round of applause. Lunge. Squat.
बड़ा दिल कितने लगेगा तेरे रंग नारा मिले सितारा वे यारा तेरे बिन मैं तो सारा वे रंग सजना मानेगा नहीं ये दिल तेरे लिए हर पल तेरी खैर मांगता रहे तू जो मेरा चित लाया शराबी रंग लाया तेरे इश्क कुछ होया है मलंग सजना तेरी डोरी हारू लेके दिलदा नहीं रहता लाया बड़ा दिल कितने लगेगा नहीं तेरे रंग नारा मिले सितारा वे यारा तेरे बिन मैं तो सारा वे रंग सजना मानेगा नहीं ये दिल तेरे लिए हर पल तेरी खैर मांगता रहे तू जो मेरा चित लाया शराबी रंग लाया तेरे इश्क कुछ सजना तेरी डोरियां नू लेके रहता लाया बड़ा दिल किते लगदा नहीं तेरे रंग दारा मिले सितारा वे यारा तेरे बिन मैं ता सारा वे रंग सजना मानदा नहीं ये दिल तेरे लिए हर पल तेरी खैर मांगदा रहे तू जो नैना चुप लाया शराबी रंग लाया तेरे इश्क कुछ होया मलंग सजना तेरी डोरी हारू लेके दिल रहता लाया बड़ा दिल किते लगदा नहीं तेरे रंग दारा मिले सितारा वे यारा तेरे बिन मैं ता सारा वे रंग सजना मानदा नहीं ये दिल तेरे लिए हर पल तेरी खैर मांगदा रहे तू जो नैना चुप लाया शराबी रंग लाया तेरे इश्क कुछ होया मलंग सजना तेरी डोरी हारू लेके दिल आगे तेरे हर रात मैनू कोई दसदा नहीं रहता लाया बड़ा दिल किते लगदा नहीं तेरे रंग दारा मिले सितारा वे यारा तेरे बिन मैं ता सारा वे रंग सजना मानदा नहीं ये दिल तेरे लिए हर पल तेरी खैर मांगदा रहे तू जो नैना चुप लाया शराबी रंग लाया तेरे इश्क कुछ होया मलंग सजना
Couple number 3, first prize. Please come on to the stage and collect your gift.
Congratulations. I would like to call upon Dr. Vinita to give away the gifts for this thing. And Dr. Ramya as well.
Couple number 12.
Congratulations to the winners.